everyone. Monsoon season has arrived. We all know in many parts of India it's raining very heavily. Uh, Recently, Delhi and all are also facing a lot of monsoon rains. And although monsoon gives us a pleasant rain and wonderful atmosphere, we like to eat well, enjoy the weather, and live it to the most. But along with every season change, it has its pitfalls and it also has some diseases which come along with it. So, with some prevention and some knowledge, we can be more aware, prevent them, and if needed, we can treat them early. So, let me summarize why we are talking about monsoon diseases and why are some diseases more common in monsoons. So, I will broadly classify easily the monsoon disease into three parts. One is the waterborne disease. You know all that water is the essential part when we use it for cooking, drinking, and everything. So that waterborne diseases are more common in the monsoon diseases because water gets contaminated in some places due to the rain, some rainwater mixing with the drinking water, and so that brings us to a lot of exposure to disease. Second part of the diseases are the airborne diseases. So airborne diseases like flu, influenza, they are uh, more common occurring in the early part of the year, and then second this year we have waves of influenza and other type of diseases because airborne is what we transmit through air because there's high amount of humidity, sudden change in temperature, and if we don't take care of our immunity and health, we are quite common exposed to the flu-like symptoms and airborne. Third and very important part in certain parts of India or many parts of Asia are the mosquito-borne diseases. So as the rain occurs, soon the areas get flooded and some water remains there. So it becomes a good breeding ground for the mosquitoes. And mosquitoes, along with bring a lot of diseases like malaria, dengue, chikungunya, and other type of diseases. So let me start with the mosquito-borne disease. We all have been seeing in past so many years that dengue, malaria, and chikungunya have been occurring in waves off and on. So one of the most feared disease is dengue. But I want to tell my viewers and everybody that most of the dengue cases can be treated easily at home. Only few may require hospitalization. Dengue is spread by a mosquito which bites in the daytime only. It doesn't usually bite in the night. Mostly it's a daytime mosquitoes. It is like our humans. It gets up in the morning and sleeps at night. It starts feeding in the day, so early morning and the daytime and the evening. So daytime is the time where these mosquitoes are more prevalent. And over the years, we have been facing malaria and all for hundreds of years. But dengue has recently come in last 30 years in a more wave form. So we still believe that we should prevent ourselves from the mosquitoes in the night, although the awareness has increased. So the protection from the mosquito in the daytime is very important. Protection in the form of small things may help us to not to stop but at least reduce the number of cases. Like as the rainy season starts, it got more humid and hot. So we like to wear half sleeve clothes, shorts and all. So children going to the school, college or offices, people going should wear the full sleeves clothes. This is a very simple basic step. We can reduce the number of cases. We cannot stop because exposed parts are there, but the exposed part of our body should use mosquito repellent. This is a basic thing, and we can reduce the disease burden. Other things that keep on popping up on our TVs and radios is not to have a breeding ground in and around our house, no? Because this mosquito likes to breed in the dengue mosquito the clean water. So any clean water in our house, in the pots and everywhere on the society roads, has to be taken care as it is. Now, if unfortunately somebody gets this disease, there is no need to panic. The symptoms are like a viral illness because this dengue is a virus called flavivirus, which enters our bloodstream via mosquito. So this flavivirus causes viral like joint pain, headache, retroorbital pain, pain around the eyes, and rashes. Sometimes these typical symptoms are not present, but any fever during the monsoon season, which lasts for more time, has to be bring in the notice of the your nearest consultant internal medicine. The problem is not, there are few myths associated. So, dengue is not about the disease of the platelets, as we have been long saying. Platelet is a very important part of the disease, yes, I know. But the liver function disease, the blood pressure monitoring, and other parameters like hematocrit, PCV, and all, they have to be also taken care of. So, now, second part is the malaria. Malaria also produces disease like fever with chills and rigor. It doesn't affect the platelets much, but it can lead to complication if it delayed and we don't treat. So again, right time of treatment and alertness will help us to prevent. Prevention remains the same. Malaria mosquitoes bite more in the night time, so we have to use any mosquito repellents and prevent ourselves from the. So whatever we can do, we can have prevention is the best cure, as we say always. If we talk about now waterborne diseases, so waterborne diseases again play a very important part. So as the rain occurs, the rainwater and brings along itself a lot of diseases which there is also a lot of breeding of house flies. So these house flies are the carrier of a lot of diseases. Their small little hands carry a lot of lakhs of bacteria and then sit from one food to another. So that can be a source of diseases like typhoid. If our water coming to our house is contaminated, we don't take care of the clean water, typhoid, hepatitis, and really leptospirosis can affect. So, like if you talk about typhoid, we have vaccines. So we should take vaccines in from young age to age of 45. There are quite effective vaccines. But again, prevention is the best cure. Try to have a clean water at your home, at your offices and schools, especially in the rainy season. Avoid street food. Street foods are lovely in the monsoon season. Everybody likes to street food, but then, as I said, the contamination is more in the rainy season. So if we could just take the food at home and enjoy our home food. Waterborne diseases are very quite widespread during the monsoon diseases. So, namely typhoid, acute gastroenteritis, hepatitis. So typhoid and other diseases are waterborne diseases, even hepatitis. So due to the monsoon, there is some chances of contamination of water, and water may contaminate by this bacteria and viruses. So typhoid is basically a bacteria which is caused by Salmonella typhoid. So there are vaccines for the prevention, but vaccines are not 100% effective. And if you take a large quantity of virus into bacterial intake, like a huge amount of street food which is very contaminated, and especially in the monsoon season, so typhoid can trouble you. And typhoid, there is a treatment of typhoid, but detecting and getting all these things is a tiring thing. So if you have any fever or pain abdomen and all, so you should visit your physician or medicine. But as I earlier said, prevention is the best cure. So waterborne and outside food should be, as far as possible, avoided in these few months. You can have your homemade feed. Another part of the acute gastroenteritis is similarly related to bacteria. If there is a lot of clean, unhygienic food, So, acute gastroenteritis seems to be like this loose motions and vomiting, but when it increases in severity, it can cause severe dehydration. One of the acute form acute gastroenteritis is cholera. Again, it's a waterborne disease, and cholera is just very severe in some cases, resulting in severe dehydration and sometimes even affect the kidneys. But again, recognizing the disease and timely treatment causes very less complications. So we should not take it lightly. Prevention is always there. And if you have a lot of loose stools and you are not able to pass a lot of urine, not able to take intake, then definitely you need a treatment for that. Other part of waterborne diseases are hepatitis, but these are viral borne diseases, but hepatitis A and E are spread by the fecal-oral route. So it is water and food. And again, these are very more common monsoon diseases because of the water contamination and food contamination, more of the insects and all along the road. So we should be very careful about our food choices in this monsoon diseases and prefer a home food, and maybe you can give a good food at home and avoid these outside food. Now coming to the third important part of the monsoon disease, which is the airborne diseases. As the humidity is rising and temperature fluctuates, sometimes we get wet, sometimes we are going from the hot weather to cold weather, drinking hot fluids, and all these affects our immunity level somehow or other. And sometimes we are in close contact with the people who are having cough, cold, and so nowadays we have seen a lot of cough, cold, fever cases. So these are airborne; it can be easily transmitted. So influenza cases we are seeing off and on in this season. Then we are also seeing rare cases of COVID also, and also normal cough, cold, and flu. So basic, what should we do? First of all, to again prevention. If we have somebody in and around has an active flu, we should use our mask if required. Avoid going to the school, colleges, and your working place. Uh, Try to be in isolation as far as possible, so that would be as a responsible citizen we can stop the spread. To build up our immunity. Immunity building is not a short wave exercise. If you take some pill and that immunity would be built, you have to do a long time exercise, good diet, and hygiene of the hands, washing of our hands and mask as we had done in the COVID times. It is a regular practice, and especially in certain times when these cough, cold, and diseases are there. The younger kids and the elderly are more vulnerable, so they should take extra precaution, avoid going to the very crowded place, and take good healthy diet and fruits, vegetables. So prevention in form of fruits, vegetables, controlling our sugar through the diabetes, controlling our hypertension, uh, prevention by using some mask and all if you're going to crowded place, and that these small things can matter a lot. Monsoon is again as a wonderful season, but we should continue to enjoy, and it helps to grow the crops. It's wonderful to see rain. We love rains, but at the same time, if we can take care of ourselves and our loved one by small tips, this would be grateful and a wonderful monsoon. And if you have any issues, meeting your doctor is always wise. With these words, I wish you a wonderful monsoon ahead. Take care and be healthy. Thank you.